Now for the next category of drugs, which we'll get to look at them, and also get to look at what examples of drugs that fall under this category, define what they are, and examples of drugs that basically fall under this category. You should be looking at what is known as what the expectorants. Okay, expectorants, all right, as one type, and another type known as the antitussives. So let's look at these guys and look at how they actually operate. So expectorants, you just know that they are drugs that increase bronchial secretion or reduce what mucus viscosity. So they make it easier for you to cough, and anything that was blocking your airways should come out. I don't know if you understand. So we have drugs like the Guaifenesin is the most common expectorant, increases hydration of the respiratory tract. So to make it that the mucus, instead of being so thick, it will thin up. So once you cough, it's coming out and it's actually reducing the load on your respiratory system. So other saline solutions like the nebulized sodium chloride, hypertonic saline, they hydrate the airways. The other ones like potassium iodide, they also stimulate mucus secretion. This is Guaifenesin. This is just a general expectorant. So clinical notes is best used when cough is productive. Should be combined with hydration. So you have to be taking a lot of fluid, because that cough, the most of it is actually made from your fluid. So you have to be replacing what's lost. The antitussives, these ones are drugs that suppress the cough reflex, opposite of expectorants, right? So classes, we have opioid derivatives like the codeine, the hydrocodone. They act on the medullary cough center. Okay, they are very effective for dry, non-productive cough. So you have been coughing, it's not producing anything, so you just give drugs that will stop the cough. Do you understand? Codeine, hydrocodone, this is what codeine, right? This hydrocodone tablets. Okay, those ones are basically the opioid type of antitussives, right? These are opioid derivatives. So for the non-opioid derivatives, we have drugs like the dextromethorphan. Okay, we have noscapine, we have the benzonate. Okay, are the different examples of non-opioid antitussives. So that's what we got for this.